want to use this opportunity to urge all Jamaicans to play their part in identifying breeding sites wherever they are, and we have found that most breeding sites are located in and around homes.
We support Minister Tufton's call. Safeguarding our health is our responsibility. Be sure to search for and destroy mosquito breeding sites in and around your communities. Remove water from your dish drainers. Check pipes for leaks. Bore holes in cans. Cover water drums with mesh and use mosquito repellent with DEET. Our magazine program continues with more information you can use to protect yourself from mosquito-borne diseases.
Look inside the drum. Those are the Aedes aegypti larvae, the one that causes dengue fever. If all of these larvae mature to be adults, and if the female larva bites someone with the dengue fever, it will acquire the dengue virus. And if that mosquito bites you, you will get it.
Dengue fever?
Yes. Help prevent the spread of dengue.
Clean up your home and community.
Destroy mosquito breeding sites.
Protect yourself from mosquito bites. Prevent dengue fever.
Good day, I'm Stephen McHugh, and this is your JIS News for Monday, January 14. The country should see a tapering down of dengue fever cases over the next 2 months as vector control efforts are ramped up and conditions change. Health Minister Dr. Christopher Tufton gave this assurance in a statement to Parliament on the dengue outbreak.
The projections by the experts suggest that we should see or continue to see higher than usual levels in the month of January, but after January, based on the efforts that we are engaged in, we should see the numbers tapering off, and of course March onwards should become place the potential threat under greater control.
The health minister also highlighted that while the number of suspected and confirmed dengue cases so far reported are more than in 2017, they are significantly less than the 2016 levels.
As of January 3 up to December 2018, there were 830 suspected, confirmed or presumed cases compared to 215 in 2017 and 2,297 in 2016.
The parishes with the most suspected or confirmed dengue cases in 2018 were Kingston and St. Andrew, Westmoreland and St. Catherine. The National Water Commission, NWC, says the broken pipeline along Mandela Highway should be replaced by March. NWC President Mark Barnett says work has started and pipe laying will commence in another week or two. The 18-inch transmission main is part of the ferry supply pipeline.
Under the major infrastructure development program, it was always envisioned to replace that main which was broken along with another major transmission main.
Mr. Barnett says it has to be replaced due to unrepairable breaks, which have disrupted water supplied to sections of the corporate area since last December. Mr. Barnett was updating the country during a press conference at the NWC's corporate office in New Kingston last Friday. He said the utility company would continue its scheduled distribution system to provide communities with piped water at stipulated times. Where this is not possible, water is being trucked to the affected areas.
And we have done that on a number of cases prior to the school reopening. And again, one of the priority for us, now that school is back since Monday, we would definitely be prioritizing schools and public health institutions. So your clinics, etc., in these communities are going to get the priority for trucking activity where water would not have been sufficient through the mains.
Prime Minister Andrew Holness has instructed the national training agency Heart Trust NTA to intensify its education programs targeting the business process outsourcing BPO sector. According to Mr. Holness, with the help of BPO stakeholders, education and training will vastly increase the country's employment rate, which stood at 1.3 million citizens in 2018. The Prime Minister has also called on HART to configure its programs to address what he terms as an aversion to work among some Jamaicans.
We must rapidly increase our training to support the expansion of the industry. It can't be that we have investors here and we are not supplying very quickly the quality trained workers. We have to get cracking on that in a more aggressive way.
Pointing to the BPO sector's susceptibility to artificial intelligence, Mr. Holness says HART and BPO stakeholders must transform their processes to include knowledge process outsourcing.
We cannot remain at the level at which we are in the industry. As I've said, the industry will not go away, it will not die, but it will transform. And if we don't transform, we will lose the industry.
Prime Minister Holness was speaking at the recent opening of the Port Authority's Data Entry Building No. 7 at the Montego Bay Free Zone in St. James. The building brings employment levels to over 10,600 at the complex and more than 36,000 across the island. In other news, Prime Minister Andrew Holness has promised the public transparency in dealing with the results of an audit report into the operations of Dunn's River Falls. He recently met with and received a full briefing from the boards of the Urban Development Corporation and the St. Anne Development Company, pointing out that the audit report speaks to corruption at the management and line staff levels. The Prime Minister instructed the UDC board to move with alacrity to ensure meaningful action is taken on the matter. The Mining Ministry's Quarry Advisory Committee has been mandated to extend the quarry license for land mining operators from 1 year to up to 10 years. Portfolio Minister Robert Montego gave the update while on a tour of the Jamaica refinery and mines on Friday.
Persons who are like Jamaica, who is doing on-land mining, you can now have up to 10 years. So when you're doing your business plan, your finances can be assured that from the government side, from the regulatory side, you would have had permission to be in business for up to 10 years. So to turn around a 1 year on a major operation like this is ridiculous. So that we are making the changes and the government is in full support of the mining sector.
Minister Montego says persons who are involved in marine mining will still be granted a 1-year license because the environmental risk of that area is greater. Meanwhile, he says the Commissioner of Mines and Geology has also been instructed to revisit the island's red mud lakes to see what minerals can be extracted from them. And finally, Jamaica has completed the first phase of the ACP EU Development Minerals Program. The program was introduced to Jamaica in 2016. Through it, over 1,750 Jamaicans have received jobs in the mining sector, 54 quarries have been assessed, and persons have been trained in development minerals.
This program has helped the country to lay the critical groundwork to enable us to move forward in increasing productivity in the development minerals industry, better manage the quarrying operations that comprise the industry, adhere to national and international environmental health standards, and prevent conflicts through effective community relations. The benefit to the country has been many.
The mining minister was making the keynote address at the final conference of the Development Minerals Jamaica. The ACP EU Development Program is an initiative of the ACP Group of States and is meant to improve the management of development minerals. These minerals are important for domestic development and include gypsum, salt, and construction materials such as sand, gravel, and marble. And that's it for JIS News Today. I'm Stephen McHugh. Thanks for watching.
This is the Aedes aegypti mosquito that spreads the Zika, chikungunya, and dengue viruses. Search for its breeding sites and destroy them. A message from the Ministry of Health.
The interim guidelines for beverages in schools is now in effect. As of January 1, beverages containing more than 6 grams of sugar per 100 milliliter are no longer allowed in and around school compounds. Get more details on this and other initiatives undertaken by the Ministry of Health in 2018.
"2018 was another dynamic year for the Ministry of Health, building on initiatives already implemented while rolling out new ones to ensure Jamaicans have accessible, quality and affordable health care. In March, the Health Ministry launched its Compassionate Care Program. After training staff and upgrading facilities at the Kingston Public and Victoria Jubilee hospitals, the program was introduced to the Cornwall Regional, Black River, Falmouth and St Anne's Bay hospitals. In 2018, the public-private pharmacy program was expanded. In March, another 35 private pharmacies began partnering with government to fill prescriptions for public sector patients. The National Health Fund NHF also launched its Quick Prescript app.
So you can utilize your smartphone to submit your prescription. These prescriptions will be processed, contact will be made with the patient, and there will be arrangements to pick up the medication at a suitable and agreed time and place.
An electronic information management system was launched at the University Hospital of the West Indies in July, as the ministry made progress in establishing an electronic patient administration system, EPAS. The ministry's electronic triage system was also expanded to include 5 hospitals' emergency departments, and a pilot for telemedicine was established at the Kingston Town Health Centre. In 2018, the Health Ministry entered into agreements with the governments of China and the UK to train Jamaican specialist nurses. The first cohort of critical care nurses headed to China in June.
Between the China-Jamaica MOU and the Jamaica-UK MOU, it has basically more than doubled the capacity, right? At least double, but I suspect more than double the capacity for critical care training for nurses in the country.
A number of groundbreakings took place last year for construction and health facilities. These included the Stony Hill Health Centre, as well as maternal and neonatal high dependency units at the Spanish Town, St Anne's Bay, Bustamante, Victoria Jubilee and Kingston Public Hospitals. Construction also began in 2018 for a standalone radiology department at the Cornwall Regional Hospital. Meanwhile, work was done to expand diagnostic and healthcare services at the Linstead Hospital, Chapelton Community Hospital and Browns Hall Health Centre.
This is important. It's important because the future of public health has to lie very importantly with primary healthcare, community healthcare.
While those works continued, others were completed. A historic moment came with the opening of the island's second state-of-the-art National Cancer Treatment Centre in the public sector.
What we have done over these many years, before my time and since my time as minister, is to effectively ensure that as a country, as a people, we have the most modern equipment to deal with those who are unfortunate enough to be diagnosed with cancer.
Residents served by the Linstead Hospital got access to an improved accident and emergency department, while the pediatric ward at St Anne's Bay Regional was upgraded. In Clarendon, residents of Moravia got a new Type 1 health centre, while the Eric and Hyacinth Hugh Health Centre in the parish was opened. It's a $40 million gift from the Hugh family.
We appreciate that because it sets a case, hopefully for so many others to follow.
A new block for housing workstations for nurses and doctors was constructed at the Portsea Health Centre in St Elizabeth, while the Glen Owen Isolation Ward at the Bustamante Hospital was renovated and reopened. 2 new elevators financed by the National Health Fund at a cost of $19.3 million were commissioned into service at the National Chest Hospital. Rehabilitation work progressed at the Cornwall Regional Hospital, while the design for a new $500 million ventilation system was completed and the contract awarded to have it built. Several facilities were provided with well-needed equipment to improve healthcare delivery in the year. The Linstead Public Hospital received 2 ambulances, while another 2 were handed over to the Princess Margaret Hospital and the Kingston and St Andrew Health Services in June. A $9.4 million agreement was signed to buy a new ultrasound machine for the Spanish Town Hospital. Savannah Lamar General Hospital's capacity to do surgeries was increased with the installation of a new $16 million C-arm fluoroscopic X-ray system. The Santa Cruz Health Centre and the St Elizabeth Health Department also received critical equipment to improve diagnostic and vaccination services. Another major milestone for health in 2018 was the announcement of guidelines for sugary drinks in schools and public health institutions effective January 2019.
Our children are suffering from an obesity epidemic, which is going to lead to significant health effects later on at our expense, but also at their and their families' expense and the future of the country's expense. And we need to do something about it, Mr. Speaker, and do something about it now.
Drafting instructions were issued in the year for the Framework Convention on Tobacco Control Implementation Bill. The Health Ministry kicked off its Take Responsibility Road Tour, while the Jamaica Moves program was expanded into schools to promote healthy lifestyle practices. The HPV vaccination program was also advanced as the ministry began administering the second dose of vaccines. Vector surveillance and control was enhanced in 2018 with the opening of the Mosquito Control Research Units in Secretary at the University of the West Indies Mona campus. And those were just some of the achievements in the Ministry of Health in the past calendar year.
This investment is first for the residents who live here.
Find out what other projects were accomplished by the Ministry of Tourism in 2018. That's the 2018 Review of Accomplishments in the Ministry of Tourism on this station.
Government's vision for Jamaica is all about inclusive growth from all sectors and all communities. Take a look.
Lexley is preparing for another day at Jamaican Teas, where he works as assistant to the factory manager and the company's hazard analysis and critical control points coordinator. He is among the men and women who, despite their physical, mental or social limitations and impairments, are learning to create value and purpose with the skills they have acquired. His life has been changed significantly because of the services provided by the Abilities Foundation.
Life was sort of weird in many ways. A lot of wasting of time in terms of parties, but yet still wanted to achieve something, but the opportunity wasn't there.
It was through a group of concerned parents, stakeholders, that their children who were disabled, after graduating high school, they had nowhere else to go. And they raised a telethon to raise funds to establish a skills training center. And through that, Abilities Foundation was born in October 1992. Abilities Foundation is a unique institution. It's the only institution in the Caribbean and in Jamaica that caters to all disabilities.
The foundation was established to meet two primary objectives: increase the employability of persons with disabilities, and teach good work ethics to young adults with disabilities to prepare them for integration into society.
The training programs I was engaged in is office administration. Being at the Abilities Foundation and being a person with disabilities, basically you are comfortable because you are amongst persons with disabilities and their understanding of conditions. I learned that there.
The courses offered through the Abilities Foundation seek to provide opportunities for full participation and equality. These programs open new skill areas and, whenever possible, are crafted within existing social, education, and labor trends. The foundation currently offers 5 training programs: housekeeping levels 1 and 2, furniture making, data operations levels 1 and 2, design and decor soft furnishing, horticulture and landscaping.
What we do is that we give them an in-house test. If they are capable of passing it at 70%, we send them up to do what you call an assessment. The assessment is done by outside persons from Heart, and they do the assessment and finish the program, certified through Heart. If they are not capable, then they will give them what you call a unit competency. That unit competency is a document or paper showing that they are capable of doing these units.
The foundation also provides a functional life skills curriculum which focuses on the students' transition to the workforce, as well as remedial English and mathematics, money awareness and management.
I assist them with preparation of their resumes, their cover letters, searching for different employment opportunities. One of my major functions is to provide them with placement sites so that they can get job experience.
For the past couple of years, we have been with the NYS, and we recognize that after that's a summer program, but we recognize that after they are placed in the summer program, it's easier for us to go back to those places to get permanent placement for them because they see what they can do and not their disability.
The foundation has been able to extend its reach and service offerings through grant funding from the Japanese Policy Human Resources Development Grant Program. The grant was provided through the Ministry of Labour and Social Security's Social and Economic Inclusion Project for persons with disabilities.
What this project endeavors to do is to build the capacity of the institution through professional development courses for the staff. A major component of this project is to assist the students with a training stipend, and it is targeted for those who are path beneficiaries. The project also provides them with a job placement officer and a job coach. So when we place them on jobs, we also give them a coach to mentor and help them throughout the process.
The foundation continues to open doors for persons with disabilities and equip them with the requisite skills and knowledge to become productive Jamaican citizens. The Abilities Foundation, creating opportunities for the exceptional.
Criminal minds think they are cunning. The major organized crime and anti-corruption agency have them running. Your friend a shout, come here. Take time running, because we ready for the ops. Drive up on your block, step out now me block. Cyber take about your laptop, pull up every lock. No evidence to drop. We put it in a cuffs and now we have the underground. Sin you say scam, you better look out for. When you move corrupt, better look out for. Please say you get wet, look out for. Look out for, look out for. From you say scam, you better look out for. When you move corrupt, better look out for. Please say you get wet, look out for. Look out for, look out for.
The proceeding was brought to you by MOCA, the major organized crime and anti-corruption agency, with the kind support of NIA and USAID.
This week is being observed as Earthquake Awareness Week. Here's how government is using technology to safeguard life and property.
Floods and earthquakes are two of the most common natural disasters. But unlike earthquakes, which usually take us by surprise, flooding to some extent can be predicted.
But when it is, what should we do with the information? And how do we safeguard ourselves and properties against this eventuality?
Through the use of revolutionary technology, awareness of the possible outcomes of a natural disaster has become more advanced. Persons are now able to use data on location, roof, and house type to create a simulation of what may happen in an earthquake, tropical storm, or hurricane.
The simulation was designed to combine place, type of structure, and event. Because Jamaica is vulnerable to four types of events: hurricane/tropical storms, landslides, floods, and earthquakes. But the same building that you live in is exposed to all four. And that same building you live in will react differently to all four.
Jamaica's landscape equally sits in low-lying and coastal areas as on hills and valleys. The country is also in an earthquake zone, so it can't hurt to do a little research on all the what-ifs, right?
You'll be able to go inside your house and see your roof being blown off, or your slab roof staying on. You'll be inside your slab roof house when earthquake shakes it comes down on you. We'll be able to have those type of simulations.
How about the possible outcome of a Category 5 hurricane if you're living in a zinc roof wooden house that is built on stilts in a river valley? So now that these predictions are available to us, just how useful are they?
This simulator is now designed to take all of that information, the conventional knowledge that we as academics know, or the disaster management professional knows, dump it online as we have. Let the developer, housing developer, have access to it and see for himself. Let the parish council person or the development approval authority play with it.
And once they've viewed it, the authorities can use the data to plan areas for development, approve or deny development applications, and build better. The simulator is not just a special effect disaster interactive tool, but one that takes into account the realities of environmental and living conditions here in Jamaica.
And the simulator also seeks to bring an awareness of the impact natural disasters may have on lives, properties, and businesses in relation to the country's national goals.
The effect a hazard would have on everything ranging from the individual to the nation is important, and scaremongering only goes so far.
The simulator allows you to either scare yourself or reassure yourself, but it's based on reality.
Another useful element to this drill is the data it uses. Historical data are planted and come to life through the simulator to facilitate emergency responses as well as forward planning in action.
Knowing where hazards are and knowing where they're not is extremely valuable information to businesses such as insurance. Instead of blanketing Portland as a hazard-prone parish, we can know which parts of Portland are hazard-prone, therefore allowing people in Portland who are not in hazard-prone areas to get lower insurance premiums. You underwrite them differently. And you also underwrite more accurately and properly the people who are in hazard-prone zones.
So, if you have already bought your dream home or are thinking of buying or building, you may want to try a few simulation exercises to test the stability of your home or to find out if where you intend to build is the best place to put down roots.
Jamaica ahead again. This is our responsibility, and we pledge to continue doing this. Time is not on our side. The industry is now fast moving.
The Ministry of Industry, Commerce, Agriculture and Fisheries worked tirelessly in 2018 to ensure continued growth of the sector. Join us on January 16, 2019 as we take a look back at the eventful year they had. MyCAF, building resilience, securing our future.
And that's where we leave you on today's edition of Jamaica Magazine. Be sure to keep in touch with us. Visit our website, subscribe to our YouTube channel, and join us on all the major social media platforms. For those of you on the go, download our mobile app that's Android and iOS compatible. On behalf of the entire team here at the JIS, I'm Theodore Henry. See you next time.
This has been a production of the Jamaica Information Service, the voice of Jamaica.